Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Bachelor's Degree Programs. Post-Basic Bachelor of Science in Nursing B.Sc.N. BNS-105 Behavioral Sciences. Block-1 Basic Concepts in Sociology. Unit-1 Application of Behavioral Sciences in Health. 1.0 Objectives. After studying this unit, you should be able to fill circle define behavioral sciences and explain its nature and scope. Fill circle explain the relevance of behavioral sciences in health and development of medical sociology. Fill circle describe the role of the nurse as change agent against the backdrop of overall changes in the society and the forthcoming challenges of primary healthcare, and fill circle explain the concept of social development and enumerate its indicators as applied to health. 1.1 Introduction. Knowledge of behavioral sciences helps a nurse to interact with patient in holistic manner, specially keeping in view the psychology of patient and relatives and the sociological background from which the patient comes. In this unit you will be reading about behavioral sciences and its relationship to other sciences, specifically about sociology and need for sociological perspective in health. Role of nurse as a change agent is also specified. 1.2 Definition and scope of behavioral sciences. Behavioral science is the knowledge of human behavior with an interdisciplinary approach to understand the human needs in the context of wider societal problems. Behavioral sciences include sociology, anthropology, minus archaeology, technical linguistics, and most of physical anthropology, psychology, minus physiological psychology, and behavioral aspects of sociology, economics, geography, law, psychiatry, and political science. Luthans has shown the relationship between behavioral science and other disciplines as follows: arts and sciences, humanities, physical sciences, biological sciences, social sciences, economics, history, political science, behavioral science, anthropology, sociology, psychology. In fact, behavioral science is a total systems approach to understand human behavior, which does not take human being in isolation but views man as a product of socio-psychological and cultural factors. Thus this science analyzes man's behavior keeping in view his psychological framework, interpersonal orientation, group influence and social and cultural factors. This helps to find solutions to problems arising due to man's complex nature. 1.3 Relevance of behavioral sciences in health. Since man is a product of its social, cultural and economic environment, medical science alone is not sufficient to take care of the health needs of the people. Biomedical approach used by the practitioners of medical science is essential, but knowledge of socio-economic complexities and socio-behavioral aspects of the people's lives have significant contribution to make for the welfare and well-being of people. Thus it is important for the health professionals to understand the factors that contribute to health and disease, have understanding of socio-economic factors that contribute to accessibility of services. It is essential that the health practitioners including nurses have insights into these aspects of patients' lives. Behavioral sciences are important for the students of nursing as nurses deal with the human beings who have complex needs. 1.4 Sociology as Science. Sociology is a systematic study of human society and their social life. Sociology can also be defined as the scientific study of the interaction among different organized groups of human beings. 1.4.1 Sociology as Science. The word sociology is a combination of the Latin word socio, meaning society, and logi, meaning study on higher level. Before we move on further, we must understand what is science. Science uses systematic methods of investigation, theoretical thinking and logical assessment of arguments to develop a body of knowledge about a particular subject matter. In the same sense, sociology occupies prime position among various disciplines such as economics, anthropology, political sciences that are usually termed as social sciences. Sociology can be explained as a scientific discipline in the sense that it involves systematic methods of investigation, the comparative analysis of data, Assessment of theories applied to human life in the light of evidence and logical argument. Thus, sociology means scientific study. It follows all principles and aspects of science in its approach and methodology. 1.4.2 Relationship of sociology with other sciences. The clear understanding of scope and distinction between sociology, history, psychology, anthropology, economics is essential for you to know as nursing students so that you can understand different facets of patients' lives. This would also help you to work better in the professional field. We have already defined sociology above, but you must know the definition of other sciences before you understand the difference between them. History. It is the record of the life of societies of man, of the changes which societies have gone through, of ideas which have determined the actions of their societies and of material conditions which have helped their development. Psychology. Psychology deals with mental processes of an individual, considered as a social being. It studies particularly the influence of group life on mental development of an individual. Economics. Economics is the social science, which studies the production and distribution of goods and services. In other words, economics studies how people make choices as to how to allocate their scarce resources to maximize their benefits to themselves. Anthropology. The word anthropology is derived from the Greek word and means the study of man. Historically, anthropologists started out by examining the lives and beliefs of traditional non-Western people. This interest continues, but studies of Western and non-Western modern societies and institutions have also become common. Relationship, differences between sociology and history. Sociology and history may overlap in the area but diverge in one and another. History and sociology. 1. History establishes the sequence of events. Arrangements of behavior in time. Sociology is relationship between events occurring at same time. 2. History is study of past. Sociology is the study of contemporary happenings and recent past. 3. It is not concerned with cause but how things happen. It gives the interrelationship between events and consequences. 4. History deals with human events, correlated in time. Sociology studies them from the viewpoint of the social relationship. 5. History describes unique events. Sociology provides generalization. Relationship between sociology and psychology. 1. It deals with mental processes of man. Sociology studies social relationships. 2. Psychology deals with human mind. Sociology deals with social behavior. 3. Psychology studies the influence of group life on the mental development of an individual and effect of individual mind on the group and the development of mental life of the groups within themselves. Sociology studies social facts derived from society, defined as being external to individual mind. 1.4.3 Relationship between sociology and social anthropology. Sociology and anthropology had both began by asking general question about nature and origin of human society as a whole. They became scientific disciplines only when they began to make empirical investigations into particular societies. The type of societies social anthropologists and sociologists chose to study in detail were from the start very different from each other. Sociology as science is of recent origin. Sociology is the study of social relationships and human interaction, whereas the word anthropology has been derived from the Greek word anthropos, meaning man, and logos, meaning study. Thus it means study of man on earth. It has three branches of study: physical anthropology, cultural anthropology and social anthropology. Anthropology devotes its attention to the study of an individual and her culture as they develop it in the long period. Differences between sociology and anthropology: as we have seen that sociology and social anthropology are interdependent, yet there are clear differences in the subject matter, methods and attitudes. Look at the screen. 1.4. For the field of sociology. In 1902, Durkheim classified sociology into A. General sociology, B. Juridical sociology, C. Moral sociology, D. Criminal sociology, A. Religious sociology, F. Economic sociology, and G. Social morphology. The other subfields of sociology are A. Industrial sociology, B. Family sociology, C. Educational sociology, and D. Health sociology. In the very recent times, the field of sociology has extended towards medical science too. Health sociology, or medical sociology, has been the subject to describe and learn about medicine as a social science. We shall give you a brief orientation about the subject in the following paragraphs. The science of sociology as applied to medicine owes its origin to the study of relationships between health phenomena and social factors in medical context. A sociological approach to the study of history of medicine gives a better understanding of the past in order to gain insight into the current trends and developments in the sphere of medical science, and thus develops an integrated knowledge to relate the life processes to the existing social phenomena and health in a meaningful manner. 1.4.5 The field of medical sociology. Robert Strauss, 1957, has visualized the spectrum of medical sociology as that field of sociology which can provide information concerning the purpose, scope, and organization of the elements of medicine which will affect the layman and professionals alike. Medical sociology enables the practitioners with information about medical institutions, the study of distribution of diseases, cultural perspectives, attitudes and values emerging from social organization of treatment centers, relationship of treatment facilities and support facilities. All fall within the purview of medical sociology. In more concrete terms, therefore, sociology of medicine refers to the study of the various broad socio-cultural, economic and political forces that shape the health services system of a country at the macro level. 1.4.6 The field of medical anthropology. The subfields of anthropology are of direct relevance to health management programs. They are A. Ethnomedicine, B. Medical anthropology, C. Cultural ecology. Each one has significant relevance from the point of healthcare both at individual and cultural levels. Let us have a brief orientation about the subject. Medical anthropology analyzes the medical clinical curative systems in different societies. Broadly, medical anthropology has been defined as the branch of science of man which studies biological and cultural aspects of man from the point of view of understanding the medical, medico-historical, medico-social and public health problems of human beings. Hassan and Prasad, 1959. In the light of the above definition, a historic approach to the understanding of the above science, we may define medical anthropology as the holistic of health, illness and related misfortunes, as these are culturally perceived, labeled, classified, experienced and communicated on the one hand, and socially constructed roles, statuses and institutional networks which are believed to help in the health-enhancing process, on the other, with a view to identify cross-cultural similarities and variation in the patterning of such behavior. The anthropologists, therefore, have to appreciate that the place of medicine in any society is determined by the current social and economic structure, the value that society places on health and disease, the tasks that are assigned to different categories of practitioners and the technology of medicine available to them. Incidentally, the World Health Forum has referred ethnomedicine as popular medicine, or popular health culture. Polgar, 1962, has further distinguished professional health culture of medical practitioners from the popular health culture of unspecialized lay practitioners. It has to be appreciated in the above context that the modern culture certainly lays a great deal of stress upon scientific medicine as opposed to folk or indigenous medicine. However, one cannot forget that socio-cultural forces play an important part in determining the meaningful of illness, function of illness and ways of counteracting it. In the above backdrop, health sociology in the context of developing nations, especially India, has a far greater challenge to face in the field of health that may provide new configurations of knowledge on social realities related to health. 1.5 Need for sociological perspective for health professionals. Mere knowledge of medicine is not sufficient to understand the health problems. Manifestation of health problems is the result of much more than the simple cause-of-effect relationship between organism and the host, i.e., human body. Hence, health and disease cannot be seen in isolation from man's socio-economic position in which he lives and interacts. It is important for the practitioners of health that they understand the different factor that has influence on health and illness. Can there be value-free science? In the broad sense, sociology is not a prescriptive science. Sociology does not prescribe particular values, ethics as good or bad. It addresses issues. Study of human relations is the prime concern in sociology. Objectivity and rationality based on thorough knowledge of a situation alone can ensure scientific status to the discipline of sociology. The goal of research is to acquire objective knowledge, free of bias and prejudices. To be sure of this objectivity, the sociologist follow the path of natural scientist. Yet biases and values do come in. The best way to overcome these is to have insights into one's own prejudices and biases. It is difficult to have value-free science, but having insight into one's own prejudices and biases helps to overcome these. The insights into one's own prejudices and biases help to be objective, and also help understanding the prejudices and biases other people have in the community that you might come across in your professional life. 1.6 Role of a nurse as an agent of change. In the light of the principles of primary healthcare and the commitment to the goal of HFA, by 2000 AD, it has been proposed to make available the preventive, promotive and rehabilitative aspects of healthcare services closer to the doorsteps of the people who require them most, more particularly the weaker and deprived sections of the society. The 8 essential elements and the 5 principles of primary healthcare call for preparation of nurses to assume responsibility specially for the provision of first-level care in the community and thus act as a change agent in bringing about a good quality of life to the people at large. This calls for not only a reorientation of the training programs but also requires a different approach to view their traditional roles in the context of primary healthcare by understanding the structural realities in our contemporary Indian society. A review of the traditional roles of nurses in promotion of primary healthcare as identified by WHO Study Group, 1985 are as follows. 1.6.1 Direct healthcare provider to the community. The move has to be in the direction towards caring for people in their everyday life in the community rather than stick to the narrow vision of hospital-oriented care. In this regard, the nurse has to be sensitive to the health needs of the people in the context of broader social changes. 1.6.2 Educator. In the context of overall social development and achievement of HFA, the primary role of nurse is to take up health education's activities in community along with the participation and involvement of local people in planning and implementing healthcare programs for their attainment of good quality of life, prevention of disease and disability and promotion of health. At the same time, the nurse has to impart this knowledge of new focus of nursing care with inputs from behavioral sciences to health and health-related functionaries in order to sensitize them to the needs to the people. 1.6.3 Manager and Supervisor. The nurse in the community setting has to act as a community organizer and to some extent as a leader in planning, organizing and implementing health services through community participation. 1.6.4 Planner. As a planner, the nurse should be able to fill circle make a diagnosis of people's belief and practices to various diseases. Fill circle identify some of the socio-cultural barriers and promoters related to treatment, prevention of diseases and promotion of health. Fill circle identify community resources available for the purpose. Fill circle select suitable health education methods, and Fill circle develop a plan of operation by involving local people and others engaged in community development keeping in mind the social realities. This also requires supportive supervision on the part of the community health nurse. 1.6.5 Researcher. This role involves updating of skill and knowledge, monitoring and evaluating activities, analyzing health conditions of people and bringing about changes and innovation in health care based on research. Last but not the least, the emerging role of a nurse as a change agent must be visualized as a social scientist too. 1.6.6 Role of a nurse as a social scientist. Realizing that man has to be understood as a member of the society and that his behavior is dynamic, which has a tendency to act and react equally within his dynamic socio-cultural environment, the nurse has to clearly understand the needs of each segment of the society. This will enable the community health nurse broadly to know. Fill circle needs of the women. Fill circle needs of the children. Fill circle needs of the adolescent. Fill circle needs of the aged, and fill circle needs of the families including the eligible couples. As social scientist, the nurse has also to study the broader issues of community involvement in health service development requiring the knowledge of